Jill, so all I would like to say is I'd like to welcome everybody to our annual report meeting. I say this every year. I am absolutely amazed when I look at it all collated together, how much we've actually managed to achieve. I think it's more impressive because of the small dedicated team of staff we have, well supported by our volunteers. Because if we didn't have the volunteers, we would not be able to do the work that we do. I'm going to hand you over to Jill now because we have a lot to get through with the report. And obviously I know that some members of staff particularly are prepared their presentations. So I'd rather then, as Jill said, please have them at the end.
Thank you, Judith.
Over to you now, Jill.
Okay, thank you. Karen, can we start at the top? Would that be okay? Can you flick it back, please? Oh, from the beginning.
Sorry, can you not see the screen?
Yeah, we can see it, but it's part way through.
Oh no, I've started at the beginning. I will close that and bring it up again. Sorry, it's doing something funny then. I've actually got slide 1 on mine, so I'll try again.
That's it, lovely, thank you. To our annual report launch. As a statutory organisation, we're required to create an annual report detailing what we've done over the previous year and then to publish it by the 30th of June each year. So I thought it would probably be a very good idea to start with just a recap who we are. So our role as an organisation is to speak up for local people on health and social care. So we basically cover anything that's publicly funded, and the idea is that by talking up on behalf of our local communities, we can make sure that the services in the county reflect the needs of the people in the communities they serve. Next slide, please, Karen.
Sorry, this seems to be having problems. It won't let me go on to the next slide. I'll just try one more time.
There we go. So we're independent from the NHS, from Somerset Council and other local health and social care services, which means that people can talk to us confidentially and freely about their views and experiences. In Somerset, our service is commissioned by Somerset Council and we're hosted by an organisation called Evolving Communities, who are based over in Melksham in Wiltshire. And EC, Evolving Communities, actually support us with back office services such as HR payroll, and they do our comms for us as well.
Jill, can I interrupt? The slides aren't coming up properly. So we've got the next slide, which is where did Healthwatch come from? But it's sort of sharing the screen with the first one.
Right, okay. Shall I see if I can share?
Yeah.
Okay, if you stop sharing, Karen, I'll see if I can share. Have I got it? Sorry, I opened it and then, right.
I've got it open, Jill. Would you like me to?
Have you? Yeah, would you mind? I had it open and then I've just had to close it in order to. Sorry, technology is a wonderful thing when it works, isn't it?
Go to and run the slideshow.
There we are.
Perfect. Yeah. Thank you. So where did Healthwatch come from? It was created back in 2012 under the Health and Social Care Act, which was introduced under the coalition Con-Lib Dem government. In fact, Healthwatch started in 2013, so it's our 10-year anniversary this year. Can't believe we've been going for 10 years, but there we go. And that act put clinicians at the centre of commissioning. It freed up providers to innovate, and it empowered patients by giving them a voice through Healthwatch. It also at the time gave a new focus to public health. So every county across the country has a Healthwatch. There are over 150 across the country, and we're all brought together under Healthwatch England. Thank you. So what do we do? We've got several main things that we focus on. We offer help, advice and signposting. People can contact us via an 0800 number or one of our email info at, or they can go to a form online as well. And we can offer them anonymous, we can offer impartial is the word I'm looking for, impartial signposting to other organisations. We anonymously record experiences in the form of feedback, and we use those experiences to influence the commissioners of services around the health system in Somerset. We visit services to see how they work through enter and view. We carry out research projects based on the things that we hear. Often all of this is tied together by going out into the community and working with other organisations as well. So that's a very short introduction. And if we move on, I'm going to hand over to Sheila to talk about our volunteers.
Thanks, Jill. First of all, I'd like to welcome the volunteers who've joined us on tonight's call. So we've got one of our volunteers who's very newly recruited, joining us here for the first time, and also a few people who've been volunteering with us for several years. So you're very welcome here tonight, and thank you for joining us. We're really fortunate to have 37 volunteers who last year gave us a total of 125 days of their time. Our volunteers get involved in much of our work. They supported us to evaluate GP websites, to encourage local people to share their experiences, and to conduct our enter and view visits. And I just want to say that in most of the pictures that we're using in our annual report and on these slides tonight, they are actual live volunteers, so I can name them, and that's Hilary in the picture here. And on the previous slide, there was Sue at the hospital and there was Richard by the spin the wheel. So it's great to see that our volunteers are being captured when they're out and about doing things. Thanks, Tanya. Next slide. We are led by a board comprising 8 volunteers, each of whom has a specialism or area of interest within the health and social care system. Our board members represent Healthwatch at meetings, both within Somerset and the South West region. Our board provides direction and oversight of our activities and priority projects, and we thank them very much for doing that. Next slide, please, and over to Karen.
Hello, everybody. My name's Karen, and I'm the Information and Signposting Administrator. In the last year, we received 2,412 people who came to us giving their anonymous feedback, and they gave us feedback on health and social care services, to help raise awareness of issues, and also we had 1,960 people come to us for advice and signposting information. We have on average 66% feedback is negative, and the most signposted organisation that we signpost to is NHS 111 Emergency Dental Service. The second highest number of feedback that we receive is from people who can't find an NHS dentist, and I can signpost them to the NHS 111 emergency service only when it's emergency. Otherwise, people really are stuck in Somerset, as there are very few NHS dentists and none of them seem to be taking on new patients. It's even getting harder to actually get a private dentist appointment in Somerset at the moment. The highest number of feedback we get are from people who can't get a GP appointment. They have to wait weeks to get a GP appointment, and then quite often they're told that it won't be with a GP, it will be with another practitioner, either a nurse practitioner or a paramedic. So that is the main issue that concerns people, the main feedback that we get. With the NHS dental situation, we've had feedback from people saying they pulled their own teeth out, pregnant ladies who obviously should receive free dental care aren't receiving that because they can't find the dentist. There are people on benefits and disabled people, and even children who haven't had their first checkup. So the situation is extremely dire in Somerset, unfortunately. Thank you.
Let's unmute. Thank you, Karen. So each year we create a work plan, which is a series of projects or topics that we focus on. Our projects are determined by a number of different things: the feedback we receive from members of the public, data and intelligence we hear from inside the health and social care system, and conversations that we have when we're out and about talking to people. This year, we also ran a public vote online using Google Forms, and we were asking people what they thought we ought to focus on. So on occasion, we're also asked to undertake particular pieces of work by stakeholders. So when we determine the areas we're looking at, we start by doing some background research into the topic to narrow the field of research down. We then create a project proposal that in essence is a project plan. That gives our comms team our rationale for undertaking the project, and it lays out our strategies and the stakeholders involved. Once the project is completed, we send the draft to our stakeholders and ask them for comment. That gives them the heads up about our findings. As by law, we have to publish our reports, and often they're picked up by the press. So if they've got a bit of a heads up, they know what we're talking about. You can find all of our reports on our website, but we'd like to talk in a little bit more detail about the projects we undertook last year. So in 22-23, we created 6 reports that were published. 2 were around dentistry that were shared with the regional local dental network. That's the organisation that was responsible for dentistry in the county. We also did a report on same-day urgent and emergency care in West Somerset, another on people's experiences of using GP websites, another on transfer of care, and the final one was an enter and view. So we're just going to share a bit more detail about those projects for your information. Thank you.
Thanks, Tanya. Thanks, Judith, Jill. Same day urgent care in West Somerset. The aim of this project was to gather the views of people living in West Somerset about same day urgent care. This is care for people who need treatment on the same day for an urgent but not life-threatening problem. NHS Somerset asked us to carry out this work as part of a review into how urgent care is provided in the county. We wanted to find out what people knew about same-day urgent care, their experience of accessing it, and what they would like to see in the future. What we did, we prepared an information sheet for local people. We produced a public survey available online and in paper format. We engaged with local groups and care homes. We spoke to, well, there were 210 responses to our survey. 76 people provided comments at groups, and we undertook 5 interviews with care homes. The key messages that came from this project: not everyone was aware of the services that offered same-day urgent care. Transport was an issue affecting use of some services. Some people used 999 or A&E because they were unable to access other health services. And not everyone was aware of NHS 111 or had confidence using it. So those are really just the headline bits from that project, and that project report is available on our website should you want to look at it. Thanks, Tanya. Next slide. Enter and view. One of the ways we can meet our statutory responsibilities is by carrying out an enter and view visit. We have legal powers to visit publicly funded health and social care services and see them in action. During these visits, we speak to users of the service and their carers or relatives, as well as staff and managers working there. We are able, through our observations and conversations, to provide a holistic view about the service and the experiences of those using it. Between August and December, we carried out 3 interim view visits to care homes across Somerset, and the reports from these are published on our website. We visited the Rosary Nursing Home in Bridgewater, and as part of our Transfer to Care project, we visited Glastonbury Care Home and Oak Meadows Care Home in Taunton, all of which you can see on the photographs, and the reports are available on the website. Thank you. And I think I'm now handing over to Mandy to talk about the dentistry project.
Hello, my name's Mandy Starks. I'm a new addition to Healthwatch Somerset. I'm the ICS Project Officer. Dentistry project for last year, we joined Southwest Local Dental Network to represent the people's voices and to gain feedback across the region. Healthwatch Somerset coordinated feedback from Healthwatch within the LDN region. We sought to address concerns regarding the availability of NHS dentists in the region. Our research involved direct communication with local people and various focus groups. The report highlighted growing concerns surrounding the shortage of NHS dentists in Somerset. And the data showed that lack of dental services is due to various factors, including closures, service modifications, recruitment challenges, and the rising operational expenses. There's a report there. You can click on the link in your own time or go onto our website and have a read through. Next slide, please, Tanya. So as a result of the work completed for LDN dentistry, we will be creating a project in our new work plan of 2023-24, understanding the oral health of communities in Somerset who are eligible for free dentistry and their access to NHS dentists. We aim to create a digital survey, promote the survey through face-to-face engagements, use these results to help inform the integrated care boards for the continuing development of the dental access in Somerset. I think that's me, thank you.
Good evening, everyone. I'm Tanya Camberwell, and oh, no, hold on. Yeah, no, sorry, I wasn't sure if I was on mute or not. There we go. Right. Good evening, everyone. I'm Tanya Camberwell. I'm the engagement officer. I appreciate you've actually had a lot of information to take in a very short space of time. So if you just want to give your hands a little shake, give your head a shake, wake yourself up a bit, because I'm going to throw some more information at you right now. So we did do a project on using GP surgery websites to access information. And the aim of this was to better understand the impact of changes to access, such as digitisation, on patients using GP services. We also wanted to investigate how and if people use their GP practice website to access information. So what we did was produce a public survey. All of our public surveys are available to complete online, or you can call us on our free phone number and complete them over the phone, or you can also request a paper copy and we can send that out to you and you can complete it and post it back using our free post address. We visited 13 venues during a 2-week roadshow that went across Somerset. I think there was only one day we didn't go out in 14 days, and we organised 3 focus groups. Our wonderful volunteers reviewed all of the GP surgery websites using guidelines that were produced by NHS Somerset. Now that's 64 GP surgery websites. So there was a lot of work that went into that part of the project. We then listened to what people told us, and 77 of 242 people who answered our survey preferred to access information during a GP appointment. And the main reason for using the GP web surgery website was actually to book an appointment or to order a repeat prescription. So I've put a couple of quotes in there that we had during the survey feedback. One person told us they would prefer to talk to somebody, but it seems impossible these days. And somebody else said they like not having to talk to anyone. They can make an appointment when it's convenient to them, i.e. after work or at midnight. So a wide variety of different views coming out there. 82% of the people who responded to the question, do you have access to digital services, said yes, they did. And only 16% of the people who responded to that question said no, they didn't have access to digital services. So out of everything that we were told, we looked at themes and we looked at commonalities, and we made some recommendations, as we do with all of our project reports. So we recommended that websites should use simple and uncluttered content and design, and avoid frequent changes to the look of the website. We found that people got familiar with a web page, and then the designers would come along and freshen it up, or they'd move pages around, and people found this frustrating and difficult to manage. We recommended that there should be explanations on how to use the website for people who aren't sure, and this could be available in a paper takeaway format, or maybe through the digital teams available at the surgeries, and also possibly through some of the help schemes going on around Somerset, provided by other VCSE organisations. We recommended that more help should be available for people who lack digital knowledge, and that people need to have their needs respected and their preferences. So if they didn't use digital services or were unable to use digital services, they should not be criticised or excluded. We also suggested that they should seek patient input to help develop their websites. That's individual GP surgeries. That could be done through patient participation groups. So another project we worked on, as Jill mentioned earlier, was our supported transfers of care from hospitals. And what we wanted to do with this project was explore the quality of the transfer of care process in Somerset, and use the experiences of the people we spoke to who have been discharged from hospital. So what we did was we analysed public feedback from our database. We also gathered 5 case studies, which gave us real stories and real depth to the experiences of those people. And we also visited 2 care homes and spoke to people about their experiences of being discharged from hospital. That helped us to build a really big picture. So what people told us was that there are issues with communication and information about the diagnosis, treatment and transfers of care for patients, that transporting patients can be problematic, and that some patients felt they'd been discharged from hospital too early. Some of the patients did not feel that they were listened to when they were being transferred or when they were in hospital. And there seemed to be some confusion in some cases surrounding the need for and the provision of essential clinical items, such as dressing replacements, required during recovery. There is a lack of continuity of care between health and social care services. We heard this especially when we were doing the enter and view visits. And this included things from the staff in the care homes they didn't feel that they received when the patients were transferred over. So another couple of quotes there. I feel as though I was discharged early because they needed my bed. And the British Red Cross has been brilliant. Nothing but thanks, and I can't fault your service at all. So as with most of our projects, we know that it works for some people and it's not working so well for others. The communication was also a problem when it came to carers and family, as they were also left out of the loop in certain times, or they weren't passed on information, or it was very last moment. So the recommendations that we made are that efforts should be made to address breakdowns in communication between all of the staff involved in a patient's care and discharge, so both at hospital and at their place of discharge. Communication from health and social care professionals to patients and their family carers does require improvement, and consideration should be given to suitable transportation of patients due to be discharged. This can be around timeframes, and also some people may not be that mobile and it might be difficult to get them into a relative's car. The needs assessment process does also require improvement in continuity and consideration about the suitability of a patient's situation before they are transferred home. And finally, as Jill mentioned earlier, this year we decided to ask members of the public what they would like us to look at during our next year of 23 and 24. So we decided to create a small public survey, which we set up on Google Forms, and we presented 5 shortlisted potential projects that have been decided looking through our database and listening to what our board members had heard in their meetings and to what staff members had heard also in meetings. And then we took this to the public and we asked them to choose their 2 most desirable projects. So 74 people across the county of Somerset completed the survey. And as you can see from the totals, 47 votes were for dentistry, 43 votes were for care at home and intermediate care. Then it would drop down to 34 votes for the cost of living crisis and the impact of health and communities. And then much further down, we had health and homelessness and health visitors. We also decided to ask the Health and Wellbeing Board to have a vote as well. So there were 16 attendees and they were asked to vote for 2 of their preferred projects. 1 member of the board decided they only wanted to vote for 1 project. So that resulted in 31 rather than 32 votes. And the 2 most popular projects were dentistry and care at home intermediate care, which actually lined up with what our public wanted us to do as well. So I think we're getting it right. And I think the public showed us that we are also along the right track. Thank you very much for listening to me today. I'm now going to pass you back over to Jill.
Thank you, Tanya. So you've just heard about the public vote that we put out. So this is just a brief indication of some of the work that we're doing at the moment. We've been doing a piece of work around access to support for mental health and emotional well-being for children and young people, looking not only at the comms around the support available, are young people responding to the comms, the posters, the literature that is out there ready to support for them, but also what they know about the services that are currently out there in the system and whether or not they're accessing them. So that piece of work we're hoping to report on in the autumn term. Mandy mentions dentistry, and you can see from our stats there that dentistry is something that an awful lot of people contact us about. So we are about to launch this project on oral health. That won't go live until August, but we're going to be running it probably August, September, October this year. So there will be a survey. If you haven't already signed up for our e-bulletin, please do. You can join via our website, and that will keep you up to date with the different projects that we're doing. We also heard about people struggling to make appointments to see their GP, particularly face-to-face appointments. So we're going to be undertaking a project around primary care, in particular accessing GP appointments. So that's another piece that we will be doing hopefully before the end of this financial year. And the final piece of work in this financial year, we work on a financial year basis, will be a continuation or follow-on from the transfer of care piece of work, and it'll be around intermediate care. So we'll basically be doing a bit of a review of the stories that we'd heard, but we'll be looking at that in a bit more depth as well. So busy. In addition to those pieces of work that I've listed there, we have been involved in a county-wide piece of work around same-day urgent and emergency care. That was in partnership with our host company, Evolving Communities. We're also currently supporting another colleague who is running a project around COPD, based in Bridgewater. We're supporting another colleague who is currently looking at revising the commitment to carers, that's unpaid carers in the county as well. And in addition to that, we're about to be going into our accident and emergency departments over September to talk to people about how they came into those departments, not so much what's wrong with them, but how they actually got to be in those departments. Did they go straight there? Did they go via 111? Had they contacted their doctor, etc., etc.? And that's a follow-up piece of work that we did back in 2021. So we were coming out of COVID at that point. We knew that our A&Es were stretched, so NHS Somerset asked us to look then at the people who were arriving in the department. So it's a follow-up piece of work from there. So very busy time. Never be said that our roles are certainly not boring. There's always something interesting going on, and I think we'd all agree, you know, that's one of the joys of actually working for Healthwatch. Thanks, Tanya. So we've kind of rattled through. There was an awful lot of information there. Our annual report will be getting some hard copies, so they'll be out and about when we're out and about across Somerset in the summer. But if you would like a hard copy, please do contact us, send us an email on the info at, and we can post one out to you. That's not a problem at all. You can access the report online on our Healthwatch Somerset webpage as well, healthwatchsomerset.co.uk. But I'll stop talking and ask if anybody has any questions about the work that we're doing, about our board, whether or not you'd like to join us as a volunteer, that would be wonderful. Or if anybody's got any questions or comments they'd like to make. Thank you.
Jill, I don't know whether you've seen in the chat, we've got, first of all, we had a comment from Julie about, well, a question. Is there a plan for an improvement to access an NHS dentist in Somerset? I suppose that's perhaps quite tricky to answer at this moment in time. Could we give any information on that one?
Yeah, so the oral health piece of work that we're doing, we've already spoken to Michael Bainbridge, who works for NHS Somerset. They are the organisation that commission dentistry now. So we'll use our piece of work to help influence the strategy around dentistry in Somerset. And hopefully we'll have that published early on in the new year, 2024. So that'll be an interesting piece. I mean, it's one of those kind of things that we think we probably know the answers, but we need to check. We need to talk to people and make sure what we think is actually the case and the experience of people out there in the community. Michael, I can see your hand up.
Well, I just wanted to say thank you. I work for the body that represents the network of community pharmacies in our county, Community Pharmacies Somerset, and I just wanted to thank you for the support, the interest, the challenge that you brought to us this year periodically. Judith was really active in helping us frame the vision for community pharmacy that Michael Bainbridge and the primary care team put together, so that when we say primary care now, we don't just mean our great colleagues in general practice. We genuinely mean general practice, dentistry, optom services, yes, and community pharmacy. So thank you, Judith, for the work on that and the vision that Michael Bainbridge curated for the 4 family members of primary care. We thought was excellent. And then also to the work of Tanya, Sheila and Jill for coming out, visiting pharmacies with us, but also bringing us the queries and keeping us on our toes and asking us for our opinion in terms of how we can make things better for patients. Keep doing what you do, and certainly my organisation will continue to support you in your good works around community pharmacy for patient care.
Thank you very much, Michael. That's very much appreciated. Thank you. And I've just spotted a question. Ruth, so what do we mean by intermediate care? It's when people have normally discharged from one of the acute hospitals, so Musgrove or Yeovil, and it's kind of what happens next. Do they go home? Do they go on one of the pathways? Are they supported through an re-enablement service in the county? So it's kind of what happens after people are discharged from hospital. Where do they go? How do they get the support? How effective is it for them? So that it'd be that kind of area that we'll be looking at. Okay.
What I was going to say was that people's perception of what their GP surgeries will give them. A lot of people are really still fixated on seeing a doctor, and they feel really cheated when they have to see a paramedic or a practice nurse, when in fact that's probably the best thing for them. And it's trying to manage perceptions to a certain extent, but not give them full access to doctor services when they really need it.
Yeah, you're absolutely right, Ruth. It's people are not aware of the full range of the allied health professionals now working within the doctor's surgeries and within the primary care networks, are they? So yeah, it's going to be a very interesting piece of work, because I think there's a fine line between helping people to understand the system and how it's changed, but also hearing the stories that they've got to share with us as well. I'm losing track of hands as they go up. I saw both Tanya and Judith come up at the same time.
If you look at the participants, it should show you what order they're in. But if you don't mind me jumping in, Jill and Judith, I just wanted to say I completely forgot to mention that we are also going to be looking at access to GPs as one of our projects this year. We didn't include that in our survey as that decision had already been made. So we knew we were looking at GP surgeries and accessing appointments. That is most definitely another project we will be undertaking during 23-24. Sorry about that. I completely forgot to add that to my chat.
No worries. Thanks, Tanya. Judith.
Judith, you're on mute.
I was only going to agree with Ruth, in as much as it's an important exercise for patients to really understand the range of people at a surgery that they could see. But I think what concerns patients the most is lack of continuity of care. So it's seeing somebody, say, this week, and then when they go back for a follow-up appointment, it's somebody else, and so they have to start all over again. And that's the thing. So I think they're more accepting of talking to, say, a nurse practitioner. But what really upsets them is when they keep having to repeat their story every time they go to the GPs.
Thank you, Judith. Does anybody else have any other questions or comments? So, as I mentioned, our report can be found on our website, and if you'd like a hard copy, please do reach out to us and we'll pop one in the post for you. As you can tell, we've got a number of different projects coming up. Laura, go on. You'll see your hand pop up.
Oh, you're on mute, Laura.
Yeah, sorry, I couldn't put my hand up and I'm on mute as well, so that's not a very good start. Thank you. Really interested in the work you're just about to embark on around the discharge from hospital, intermediate care and onwards. what I've experienced in my recent career is around when patients are discharged, they the care provider that they're discharged to has been awarded a care package, but is wholly underprepared to receive that patient in terms of the training of the staff, if they have complex care needs. And you mentioned in your report, Tanya, about the lack of clinical kit and equipment, etc. I'd be really interested if your work you're just going to embark on is going to touch on any of that readiness.
Absolutely. And it wasn't throughout. I think there was definitely some confusion about kit and equipment that was available. So there were cases where it was available, and quite rightly so, but there were other cases where maybe it should have been available and it wasn't, or people didn't realize that they were responsible for supplying various different things themselves. So but yes, certainly we can definitely include that when we do that follow-up piece of work.
Yeah, just to add further to that, okay, I'm from a learning and development background, currently still am, and I've always had concern since I used to provide care homes with training around competence, clinical competence, that care packages are being awarded to care providers that don't have the competence to receive the patient. And therefore then they're scrabbling to get to that training at the last minute. So it would be me particularly interesting around, are the care providers competent to receive that patient? Thank you.
Thank you. And you touch on a very good point there. So we're conscious that there is an organisation called the Registered Care Providers Association in Somerset, and they have what are called trusted assessors who go in and talk to people who are due to discharge. And part of their role is to assess whether or not the care home that they're going to can cope. So I think, yeah, there's a very interesting piece of work there that we'll possibly be linking in with. Thank you.
That should be part of discharge.
Julie.
That's very valuable what you've just said. Sorry, was it Laura? Because I've had some very difficult situations where care companies in the community have been awarded a contract and they have not had the training or the staff in place to be able to take up that contract. And even when they were due to start the next day at someone's house, the actual manager actually said, I don't have anyone in place at the moment. So they hadn't even had any training when they turned up. And the other thing that I have a concern about, particularly with people with dementia, is when the care provider, so the actual carers that are going in to support people with dementia, and they don't have clear spoken English, that is a real problem. I think that if somebody is going to support someone with dementia that speaks that their English, that the person they're supporting is English, obviously, I mean, that the person with dementia is able to understand the language. It's difficult enough for them to understand what is going on, but when someone, it can be and it can be very frightening for someone. If someone is talking to them in a foreign language, they're totally thrown. And I have had several things reported to me about that. So I just want to be really valuable to include that. And
thank you.
Yeah.
Thank you, Julie. That's much appreciated. If when somebody's reporting something, if you can feed that in to us, that will enable us to create a body of evidence to go back to adult social care to say, look, we're hearing this, because part of the thing that we're doing when we're reporting and influencing, if we can see that there's a theme occurring, so in other words, if English is not a first language and that's causing a problem with your client group, if care agencies aren't prepared, for example, to receive people being discharged from hospital as well, that would obviously be another theme as well that we could take forward. So please do either drop a line on email to Karen or just pick up the phone and have a conversation with her. It doesn't need to be too much. We don't need people's personal details, but we just need to know how often this is kind of happening so that we can take it a step forward. Thank you.
Yeah, they did actually go to CQC, but
Yeah.
I should have given them your details.
Thank you.
I will do.
Much appreciated. Kate.
I'm sorry I was late. I'm really concerned about this because discharge planning, as we all know, is really important in the hospital, and you know, we've got delayed discharges and all the problems around that. If the staff are not qualified to take that patient out in the first place, that should have been picked up on the discharge planning. And if that is happening, then certainly the hospital need to be aware of that, and they need to be told that. And I think it's really important that that message is taken to the hospital. I mean, I'm happy to do it on behalf of Healthwatch. It doesn't worry me, but I'm sure Judith would as well. But that really concerns me, because that is not only dangerous, it's unacceptable.
Yeah, I must admit, I agree with you, Kate. It's the first I've heard of it.
Yeah.
And so I think we need to do a little bit more digging into the background of that, just to make sure we've got our facts.
Yeah,
overall.
I agree. So
Yeah.
perhaps you and I can get together, Judith, and we'll have a chinwag over the phone or something. Are you all right, by the way? We missed you today.
Oh, I won't bother to tell you what happened, but I had an accident yesterday. So
no, so I hear. So anyway, but it's nice to see you here tonight.
Thank you.
Thanks, Tanya.
I'd just like to say thank you, Julie, for joining us today, and just to let people know that Julie works for the Alzheimer's Society, and is a very rich source of information, and both her and Jackie, who is also here, thank you, Jackie, online tonight, are very big supporters of Healthwatch Somerset, and we love to hear your feedback. So thank you for joining us.
Thanks, Tanya. I saw another hand. Has it vanished? Okay, I think that's everything. Does anybody else have anything else they'd like to add? We are always really keen to hear. So if you're identifying things, if you're hearing of things, if there's anything that you feel, now you know what our work plan is looking like, if there's anything you feel that we need to know, that we can include, that we can investigate, please do reach out to us, any of us, or via our phone number or info@Healthwatch Somerset. That would be really useful. So we have got some interesting pieces of work coming up. It is a very challenging time for everybody in the system, I think. So, you know, it's a very fine line. We want to be constructive in working with our partners across the system, but at the same time, our role obviously is to provide challenge as well, to sort of say, well, why is this happening? What could we do differently?
Yeah, I think on behalf of the board, all our board members are usually on some strategic boards, so we can accelerate things quite quickly if it's obviously a safety concern, or we really feel that this message has been missed. So anything that you are the ears of the community, everybody. I always say that to all our volunteers. Because what you hear in the community is actually what we really need to know. So it might seem quite small and trivial in the great scheme of things, but it's not necessarily, because if you're hearing that or you're thinking that, other people will be as well. So please do contact us. Well, I'd like to thank everybody for giving up their time to come and listen to us tonight. As I said at the beginning, I am so impressed with how much we seem to do, but it also looks as if we're really going to have another busy year, and that's great. you know, because any difference that we can make to the quality of health and care that people receive, we will consider that to be a gold star. So thank you.
Thank you very much. Enjoy the rest of your evening, and we appreciate you spending the first part of it with us.
Thank you. Good night.
Good night.
Thank you very much.
Thank
Yeah.
you.
Good night.
Thank
Thank
you.
you. Thank you.
Bye.
Right.
Bye-bye.
Bye bye.
Bye.